Assalamualaikum and good day, sir, and to everyone. My name is SALINA JASMIN binti HAJA MAIDEEN, and I will be explaining about my case study, which is about atrial fibrillation. And the specific case study is about a case report of cardiogenic shock and death following electrocardioversion for atrial fibrillation. So I will be explaining in general what is atrial fibrillation, which is short as AFib. So if AFib is a irregular heart beating, where the rhythm is irregular and it can cause serious complications such as blood clots, stroke, heart failure, and other cardiac related issues. So what happens during AFib? So in AFib, the upper heart chambers, which is known as atria, they beat irregularly. So when it beats irregularly, it causes insufficient blood flow, where the blood does not flow very well to the ventricles, and the blood keeps on rounding up in the atrium and causes the blood clot. So this blood clot are the main causes of stroke that some people may get. And this, for patients of AFib, they may give blood thinners to make the blood flow well. Okay, so the patient is a 70-year-old woman who came to ER with a few symptoms. Present symptoms of dyspnea, means shortness of breath, then palpitations of 150 beats per minute, and the vital signs are steady, the blood pressure, which is in a normal range, and then on the examination, have found crackles at the bases of lungs, bilateral pitting edema, jugular vein distension, and erratic heartbeat. Erratic heartbeat is known as irregular heart rhythm, and it indicates from this examination we can indicate the we can find that it is atrial fibrillation with rapid ventricular response (RVR) and acute decompensation of severe heart failure. And for this patient, they have a medical history of rheumatic fever during childhood, hypertension, diabetes mellitus, hyperlipidemia, which is high level of cholesterol, AFib, used to have AFib in 2014, and heart failure of ejection fraction 45%, which is below the normal range. And then also, based on the patient's journey, she had electrocardioversion for recurrent AFib 2 months before, and it was effective. And she chose catheter ablation a month later, then success bring the heart rhythm to normal regular rhythm. Okay, so you may be thinking, what is electrocardioversion? Electrocardioversion for recurrent AFib is a procedure that uses a controlled electric shock to restore the heart rhythm from irregular to normal. So the purpose is to reset the irregular rhythm that the patient has. That is for electrocardioversion. And for catheter ablation, it's a minimally invasive procedure where a catheter is guided into the heart to destroy small areas of heart tissue, causing abnormal electrical signals that is disturbing the heart rhythm. So that is a catheter ablation that the patient chooses. And the purpose for catheter ablation is a longer term solution to prevent the AFib episode to happen again in future, and also to maintain the patient's normal heart rhythm. Okay, so based on the ECG that we have here, the first ECG, this first ECG is the pre-cardioversion ECG before the current cardioversion, and the patient has a very fast and irregular heartbeat as she was presented in the ER before, and she has a very rapid heartbeat with the range of 148 to 152 beat per minute, which is higher than the normal range. And based on the ECG also, we can see the criteria of AFib. The first one is irregular rhythm, where we can see the R wave interval is not same. The second one, we can see the heart rate. We can calculate the heart rate, which is more than 100 beat per minute, which is high heart rate. And we also couldn't identify the P waves in this ECG, and this is also these are the criteria for AFib and that are found in this ECG. So this is the ECG of cardiac rhythm during cardioversion, 200 joules on telemetry, and we can find a brief pause or any flat line may appear as the heart resets, and this happens due to electrical impulse depolarizing all myocardial cells simultaneously. So this is what it calls a brief pause. So this ECG is the ECG of post-cardioversion ECG, where the patient's heart rhythm is back to normal and the heartbeat is 90 beat per minute, which is in a normal range. This ECG is a normal ECG after a cardioversion was done. So the next one is I will be explaining how did we manage and give treatments to her. So the patient had a very fast and irregular heartbeat and was given medications like furosemide, metoprolol, and amiodarone, but her condition didn't improve. So an electric shock, which is known as the electric cardioversion, helped restore her normal heartbeat, which was the previous ECG. But then it caused her heart's pumping function to worsen more severe, and then it leads to heart failure. So poor blood flow to the body. So the doctors used machines like a balloon pump, which is known as IABP, and an impeller device to help her, heart pump better. But the patient condition got slightly better for a little time only, and then her organs started failing, and after talking with her family members, the decision was made to stop treatment and focus on keeping her comfortable. So eventually, at last, she passed away peacefully, and the family declined an autopsy. So based on the discussion, this is the first reported case where the AFib caused heart weakness, and when treated with the electrical cardioversion, the patient went into severe heart failure that didn't improve with mechanical support such as IABP or impeller. AF increases the risk of heart failure, and having both makes the condition more worse. Aggressive treatment to control AFib is recommended to reduce heart damage. In this case, medications didn't work, so ECV was used, which is generally a safe procedure. However, rare complications can happen, such as low blood pressure and heart muscle weakness. The patient had a history of rheumatic fever and long-standing AF, making her heart more vulnerable. After ECV, her heart's pumping ability was more weakened, likely due to changes in heart cell function. So her QTC interval, a measure of electrical activity, was shortened, which ruled out another possible cause. So this case highlights the importance of being prepared for rare complications from ECV and having immediate support available for high-risk patients. Okay, so the SWOT analysis, we have for strength, we have a quick plan, modern device usage, and teamwork. So we have a medicine when medicines didn't help, so the team quickly decided to use the ECV. And then for use of modern devices, the team used devices such as IABP and Impella to manage the patient's heart failure. And then for teamwork, different medical teams work well together to take care of the patient. And then for weakness, we had existing heart risk, ineffective medicines, and the outcome. So the patient had of heart problems, low EF 45%, and a history of heart treatments which increased the risk of complications, and the medications didn't work, and which delayed fixing the heart rhythm and worsened the patient's condition. So despite this crucial care, the patient died from severe heart failure, raising concerns about how to better assess risk and choose treatments. And the last one is opportunities, where better risk identification, improved monitoring and learning opportunity, where this case shows the need for better tools to identify patient high risk of complications after ECV, like ventricular stunning, and improve monitoring to set up better ways to monitor the patient that help catch problems like heart failure earlier. And learning opportunity, where the rare complication provides a chance for doctors to learn more on how to manage patients high risk when using ECV or after using the ECV. So that's all from me. Thank you.